Hi there, knock knock. You ready for your assessment? I'm Dr. B, nice to meet you. I'll be performing your sensory testing today. Now we are having you in today due to a referral from your primary care doctor. I'm just going to go ahead and review their notes on you. So it looks like you're experiencing some tingling in the back of your head. Okay, and looks like there was also some headaches and fatigue. Okay, and how long has that been going on? Any other symptoms? Any dizziness or vertigo? Any inability to sleep or trouble relaxing, resting your body? Have you noticed any changes in your memory or ability to process information? Okay. So it's mostly just that tingling sensation. And is it anywhere besides the back of your head here? Is it anywhere in the front of the face? Not sure. Okay, we can check that. So this is going to be a fairly thorough sensory exam. We're going to check out all aspects of the neurological functioning of the face because you're experiencing that tingling and a couple of these other symptoms like fatigue and headaches. Okay. All right, let's get started with the assessment. And I will just be making notes along the way in your chart. Okay, I'm going to first apply some gloves. Now, this is a later appointment. How was your day today? Okay. A little stressful. Yeah. Were you working today? Yeah, that'll definitely cause some stress and discomfort, but hopefully this exam will be pretty relaxing for you. I'm mostly going to be testing the sensory functioning in your face, which will require your eyes to be closed. So feel free to just flutter those open and closed as needed for comfort. But I will let you know when specifically I want you to close your eyes, okay? So first thing I always do, besides put on my gloves, is check the face. So just keep in mind there will be a light coming through into the eyes, so just try not to look directly at it. I am looking for any obvious signs of distress, bruising, or scrapes, any discoloration of the skin, hardening of the skin, things like that. Just gonna get a little closer. Okay, now I'm gonna look just a little further away. I know it's gonna be a little bit blurry with the light being so bright, but feel free to close your eyes. Okay. Let me palpate the face. So if there's any tenderness here, I want you to let me know. Feeling for any swelling, tap on the face now, okay? And I'm not looking to see just yet what you're feeling. I'm feeling for different sensations of the skin on my end, okay? So just relax. All right. Was any of that too tender to proceed? Great. So I did not notice any abnormalities with the face. We're going to move on to our first sensation. So this is going to be quite a hard stimuli, and I'm going to be poking you on different parts of your face. Just tell me if you can feel it, okay? Can you feel that? Okay. Did you feel all of those? There were a couple you missed, actually, that you didn't say you could feel it. Okay. I'm going to redo those spots and just tell me if you feel this right here. Did you feel that? Not really? Okay, try this one. Okay, a little bit. Good. This one. No. Okay, and then this one right here. And you did feel that one. Okay. Good. So we missed 7, 9, and 10. And we had micro sensations on 3, as well as full sensation on 5. So I'm going to move to a slightly softer stimuli now. So you did feel most of those sensations. So I've got a couple of sticks here, and I'm just going to be going left or right, okay? And I want you to tell me again, yes, when you feel it. Feel that? Right there. Feel that? Anything there? Not really? Okay. Try this side. Good. here, a little bit here. Feel that a little, but you can't feel here. Okay. All right. I'm going to do another test before we proceed, and I'm going to touch the right side or the left side of your face. I want you to tell me which side I'm touching, okay? Keep your eyes closed. Okay. Good. Can't feel that one. Okay. How about this one? Good. All right. So unfortunately, there were a few there that you missed as well. And those ones you were even less sensitive to. So I'm going to do one more test with my most soft stimuli. And I would not be very surprised if this one was kind of difficult for you to absorb the sensation for. But again, just say yes when you feel it. And if you don't feel anything, don't say anything. Okay? Good. All right, so you have a little bit of conservative sensation, really intense neuropathy in some places, but not as bad in others. Not feeling any of this, huh? Okay. Can you feel the difference between here and here? Yeah, it feels more on this side. Okay, what about here and here? That feels the same. What about here and here? Can't feel it at all. Okay, here and here. Still can't feel it. Alright, I'm going to test this side just really quickly. Anything there? A little bit. Going down all parts of the face. Just say yes when you can feel something. Okay, good. Bottom left. So there are certain dermatomes that do seem to be more reactive still than others. So we're still looking at quite a bit of sensory loss in zones 7, 9, and 10. So that is the left cheek area, the right and left temple area. But you are maintaining decent sensation in the right and the left jaw. That mandibular joint is intact. Okay, I'm going to be changing sensation now. So instead of something sort of soft or dull, we're going to move on to something sharper. You should be able to feel this more than you may have felt the other sensations. It's going to be even firmer and more prickly, but tell me if it feels sharp or dull. So sharp will feel like that prickly sensation, and dull will feel kind of like it did before. So I'll be using the Wartenberg wheel. You will hear a little bit of a sound. That's normal. Try not to react to the sound and only to the sensation, okay? So I'm just going to start, I think, on this side. Okay, so I'm going to start by running it down the left side and then the right side, and then I'm going to go each dermatome. So starting up in the temporal joints, temporal section, okay? Good, so that's okay. Okay, and I'm going to go to the jaw. So feels dull on that side. Dull here. What does that feel like here? Sharp, okay. Dull here. Sharp there. Okay, I'm going to move down to the jaw. What does that feel like to you? Sharp or dull? Just the slightest dull, okay. Sharp or dull? Slightly dull. Sharp or dull? Slightly dull. Sharp or dull? Oh, that one felt a little sharper, okay. I'm going to come really close now and try it to see if I can kind of press a little bit harder. I'm not going to break the skin or hurt you, but it is going to be quite firm, okay? Tell me what the sensation feels like, please. Every time I run it. Okay. So yeah, you're still struggling quite a bit with those, but the harder I press, the more you feel it. So I've got a few more tests for you. I'm going to use a little puff of air. And again, you will hear the sound on this, but I'll be tricking you. So keep your eyes closed and only alert me when you feel a sensation of a puff of air on you, okay? Good. Anything here? Not really. Anything here? No. And try your chin. You feel this more on the right side or the left side? More on the right side, okay? And do you feel that there? Yes. Do you feel that there? No. Okay. I've got two more tests. This one is vibration. So I'm going to be hitting this tuning fork and placing it right on top of you. And I want you to just tell me if you feel this vibration sensation and when it goes away, okay? Good, so you were able to feel that pretty much until it stopped and I stopped feeling it, so that's excellent. Let's try over here. Good, excellent. Okay, I'm going to try up on your temples. So that one definitely had the least longevity. You said it stopped well before I felt it stop. Let's try over here. Okay, So you are experiencing some of the vibration sensation, which is great, all over the face. I'm going to try just in the middle of the forehead and on the chin to finalize this test. And now the chin. Good job. And both of those were normal, expected responses. So that tells us something very important. It tells us what's being affected. So the deeper level of sensation, the vibratory sensation down below, is not really being hugely affected. It's really that surface level sensory deficit. Right. To finish off, I do want to test your cold or warm sensation. So I have 2 vials, and I'll be holding 1 or 2 to you, and I want you to just tell me what that sensation feels like. It's either going to be cold or warm, okay? So cold and warm. Okay, keep your eyes closed and just tell me what sensation you feel. Good. How about now? Good. How about now? Good. How about now? Okay, I'm gonna do mini, miny, mo, mini, miny, mo. Okay. Now I'm gonna do this side. Good. And do you feel the difference between this and this? Between this and this? And between this and this? Very good. So again, warm and cool sensory functioning is intact. I'm going to take the temperature of the face. I'm wondering if there's something going on with the skin, like some sort of bacterial infection. It does just look a little red and inflamed, but that could also be normal for your skin tone. I've not seen you before, so I'd have to look at a reference picture of however long ago before this problem started. So I am just going to be taking your temperature. Temperature is consistent, but it is a bit on the warm side. Let me actually just take the temperature behind your ears to see if you're running a fever right now. No, so the temperature on the face is fully warmer than the temperature on the back of the ears, which is generally where we take the body temperature from. And I want to check your reflexes as well to make sure there's nothing else neurologically going on. Relax. So, I think that's I am going to refer you for a topical medication. It's going to kind of go on like a light cream onto the face. And I want you to focus especially on these areas here and here. I think you may be experiencing a slight fungal infection of the face. Could be from like letting a dog kiss you all over on your face, like your best buddies or something like that. or perhaps just the oppressive nature of late-stage capitalism. Whichever thing kind of could definitely cause some discomfort and distress to the face, and that could affect your headaches, your fatigue, that tingling, and your sensation, okay? All right, I'll go ahead and write you a prescription, and you can pick that up from the front desk on your way out. Do you have any other questions for me? Okay, well, thank you so much. I hope you feel better soon, and feel free to return for the appointment anytime you need.